Good morning, good afternoon, and good evening. Welcome to the 474th day of continuous Zoom session of Ifph. Let us start our program with a silent prayer for 1 minute. Today, our guest is Dr.T Ajayan, MD, Professor, Chairperson of Homeopathy Medical College, Kanyakumari District, Tamil Nadu, India. The topic is bronchial asthma and its management. It's an important topic. We all know that a lot of persons are suffering from bronchial asthma, and the treatment of this bronchial asthma by the allopathic system of medicine is an example for what Hahnemann said, or what Hahnemann tried to reform the medicine, because they did reduce their dose from large doses to injections to now the inhalations, the same medicine. It did force them. What homeopathy said is substantiated on that aspect. We can hope that they will recognize more on that. So on behalf of IFH, I am once again welcome Dr. Ajayan. You can have a platform for the next 40 minutes. It's over to you, Dr. Ajayan.
Okay, thank you, sir. Good afternoon to all. Again, we are gathered here for another session. It's related to bronchial asthma. In our day-to-day practice, and suppose, and before that, I would like to convey my sincere thanks to the organizers again, give me an opportunity to present a topic, is bronchial asthma. Normally, while the discussion of the bronchial asthma, we are discussing the symptomatology and homeopathy perspective. But then today, the slide we are changed from the usual mode of presentation of the therapeutics of bronchial asthma. As we are very much aware of each drug and its therapeutic application, I am here to present before you a statistical analysis of experience of different eminent practitioners then who were known to be a very efficient to treating the disease, especially bronchial asthma, along with my clinical, that means my personal experience also share with you. Then everybody know the management of bronchial asthma, and sometimes it's a Herculean task, especially the two types. Then one is the brittle asthma, and second one is, sir, is an audible? Sir, is an audible? Okay, it's a brittle asthma, and another one is the status asthmatic condition. The both are the severe form of bronchial asthma. But this these statistical studies, then for that I am prepared the 20 questions. These 20 questions we are circulate throughout the eminent practitioners, and then we are collecting their experience that I share with you. Then not only this time I am sharing not only my experience, but at the same time also they included my experience. Then just please wait. Just I share my PowerPoint. Then yes. For that, just please wait. Then I already say them. For that I had prepared then a questionnaire which consisted the 20 questions that are very relevant in homeopathy practice regarding the treatment of the bronchial asthma, and collected their frank opinion. And maybe there's so many the different opinions is there, but in this particular session I would highlight their opinions and suggestions, maybe to make this session is more informative and useful. I heard send this questionnaire to most of the doctors in Kerala and Tamil Nadu, especially in our nearest districts, that were from Nagarkovil, and they collected their experience regarding the treatment of it. And here I present here. From that I made this analysis and found it to be more informative and doubt clearing to many of us. Majority of us had a lot of doubt regarding the management of bronchial asthma especially the acute form of it. Then already I conveyed to you. Then acute form, the two important types, that is a bronchial asthma and status asthmatic. That is a stage, the status asthmatic condition. Whether we could manage it without any accessories or any need of other medicine or with our own symptomatic treatment. In my personal experience, and suppose with the help of accessory measures, yes, simultaneously we are using, that definitely we are even the 50 to 60% of our status asthmatic condition, we are able to manage it. Then for that definitely our need, the accessory management is an oxygen therapy. Let us see the analysis of inquiry, what the experience says, how they had managed it, rather than my personal opinion. For that, the first question, because only only 1 hour. The first question, in which age group that you get the maximum number of bronchial asthma cases? Then the girls or women, the boys or women, then average, the majority of their opinion is a different, but the most of the doctors answered that it was in both male and female. Of children and adults, the consisting with the normal age group incident of the bronchial asthma, I do found that the most of the cases were it is younger in adults. That is, they are highlighting 1 to 10 years, then 21 to 30 years is the most of the age group is an affecting. Then I hope then in your practice also in this particular age group, is most of the patients in this particular age group. Then so many eminent doctors, their opinion I have collected, Dr. Chidambaram, Dr. Edward, Dr. Mahesh, Dr. Mohanlal, Dr. Mansoor Ali. There's so many eminent physicians, their opinion, we are collectively, we are considered and statistically analyzed. This particular age group is affected. Then next question, whether the bronchial asthma is prevalent in your locality, if so, any proposed reason and whether it is helping you to select in the seminary. If answer is yes, then please specify. That is my question. Then here, then everybody, then related it with the exposure to dust and allergens, and also the coastal areas where the humidity played its major role. One doctor from Alappuzha related it with the paddy plantation and the presence of the rivers. Then certain emotional factors are also along with the hereditary tendency are also there. Then another few group says that therefore I am coming. Then I am coming from these particular areas in Katakata, whether the humidity is more due to the hills and the rubber plantation. Then I am working in Sharada Krishna Homeopathy Medical College at Koleshegaram. Is also most of the places were crowded with the rubber plantations. This shows that the different localities place their own influence on each individual. There is no a separate cause. Also, this time I remember, then the master says, the cause of the disease, we are studying the cause of the disease, what is exciting cause, what is the maintaining cause, and what is the fundamental cause. This time I remember, what is the need of the understanding of 3 causes? Need for their knowledge is an help for the right prescription of the homeopathic medicine. This shows that the different localities play their own the influence on each individual. These are the exciting cause which act as a fertilizer for the seed of the fundamental cause. You know the fundamental cause is the miasm. That means miasm to grows. So the homeopathic management for individualization that we considered. Then one doctor is and says whether this for this question, their answer is if as the please specify. Then he says the localities my clinic most of the cases the allergic dust and the climate. There's so many reasons already conveyed. There is one doctor from Alappuzha that is related to the paddy plantation. Another one is related to the rubber plantation. Then another doctor I say is not prevalent, but the common in school children may be due to the dust and rodent, dust roads and the schools. Then another majority of the doctors, their answer is due to allergic. That is dust, smoke, food. Therefore, a doctor recommended in that particular cases, those who are then asthma is due to smoke, food, they are recommended. Then an eminent doctor from Madurai, the Dr. G.P. Hahnemann recommended. Then for that, then 5 drugs. One is an arsenic album, pulsatilla, bromium, calibite, and naxobica. Then another eminent doctor from Madurai, Dr. Sambarati, is and says the important reason is the dust. Then another doctor, Chidambaranathan, is an commended is an pollution because of road dust and rice mills. That is unfamiliar in that particular place. Then place to place, the reason is the vary. Then prevalence is present. Then this time you remember the related to the exposure to the dust, allergenic, humidity, emotional and hereditary. Just I remember this time you remember the aphorism number 5, the fundamental cause. And also I convey with you the importance of exciting cause and the importance of maintaining cause. And third question, in which phase do you get the maximum cases of bronchial asthma? That during the attack or without attack? The most of the practitioners are answered this question, whether they got cases during attack. They got cases during attack and also in chronic state. Then few, their answer is infused. In chronic state also the patients are without attack. That means the chronic state is also reached in our hospital. The most of the doctors says that during attack. Then fourth question, what type of management you are giving during the acute phase? Is that nebulization, then use of the tinctures, the potency, or depending upon the severity of cases. Then another question added, if they just to specify the potency, that is a low, medium, high, and LM potencies. They said, the majority of the doctors, they said that they could easily manage in acute case, acute stage, depending on the severity of the cases, with the potentized medicine. Most of the doctors that says the management is very easy, then with the help of with the use of the potentized medicine. The most of them use the medium potency. It's not low or higher or LM potency. Majority of the doctors there comment it is a medium potency. Some few doctors then says then low and as well as LM potencies. Then out of these, then low and LM potencies, the next group is most of the doctors are like the LM potencies. In my knowledge, then because it's a hypersensitivity, therefore it's that due to the hypersensitivity, there's a hypersensitivity followed by bronchospasm. Therefore, the chance for unwanted homeopathy aggravation. Then suppose a well-selected remedy may be producing unwanted homeopathic aggravation, even a single dose. In my practice also, a well-selected remedy sometimes then severely aggravated. A homeopathy aggravation is there. In that cases, maybe need the LM potencies, the 50 millisiemens scale of potencies. This also showed that the selection of the potencies mainly or strictly depend upon the individual susceptibility of the cases. The understanding of the susceptibility not only related to a particular factor. Then at this time, I remember the 5 factors to be considered for understanding the susceptibility. One is the severity of the disease, the pathology of the disease, then individual characteristic symptom, then age, then sex, everything you are considered for the understanding the susceptibility. And here some doctors suggested the use of the mother tincture and the nebulization. But a strong, I'm not recommended the nebulization. The nebulization, somewhat the doctors are think about is our like, which are olfaction method. Actually, the nebulization is entirely different from our olfaction method. Then Hahnemann is a new recommendation is in the sixth edition of organon, our 50 millismell scale of potencies and olfaction method. But unfortunately, the most of the homeopathy doctors are not use this method, the olfaction method, in their day-to-day practice. But the later, the Hahnemann in one of the invention is this one, the olfaction method. But the nebulization method is not similar to our olfaction method. We are discussed later. Then doctors are for the nebulization. The few doctors are recommended certain tinctures, is in Plata, Aspidosperma, Aurelia, etc. But is not good for the patient. Because why? Because it will contain the alcohol. Our medicine, all medicines are contain the alcohol. Then tincture form definitely there alcohol. Then irritate the lung parenchyma is no doubt. Therefore, my personal suggestion: they never use the tincture for this one. For the nebulizer, they never use the tinctures. The normal saline, okay, is recommended. The slide is a bronchodilator. Okay. Then internally, the doctors are recommended in acute phase the tinctures, the same tinctures, Plata orientalis, Aspidosperma, Aurelia, Pothos, Justitia, Grandilia, etc. But in my personal practice, in my earlier practice, I'm used the tinctures, the Plata and the Aspidosperma, then very good result. Then especially Aspidosperma is very useful for the management of the acute asthma, asthmatic condition. But in this time in my practice, I'm not used any tincture for this one, for this allergic than bronchial asthma. Then it is a doubtful question that whether the mother tincture is a homeopathic or not. Yes, sir, definitely in my personal opinion, the mother tincture is an homeopathy, but same time, then we are used the medicine in the minimum dose. Suppose in minimum dose, we are used the tincture, their action is there, definitely is the dynamic action. But the more amount of the tinctures, we are prescribed for a particular case. I am not saying it's an action of a dynamic action of a homeopathy medicine. But in minimum dose, then in Hahnemann in chronic disease, the beautifully recommended, then what is a dose? That the difference is there, the dose and minimum dose. A dose means at a time we are given a dose. There is a dose. The minimum dose means the least quantity of medicine to enhance the vital power. Those is not my of this today's our topic. But if it is useful for cure or not, this is our lower potency medicine tincture. Then the dynamic power present, it should be used for in minimum dose. Then they should be differentiated and used on the basis of symptom similarity, not blindly. That is another recommendation. As this is a dynamic derangement of vital force, their cure can only be done in dynamic medicine. As and I remember this time, I remember then aphorism number 16. Then depending the severity analysis, the most of the doctors, there is depending on the severity, then potentized medicine they are using, especially medium potency. Then few doctors says mother tincture. Then the fifth question is, if depending upon these cases, can you give some suggestions? As while analysis of their opinion, the different potencies, there is an olfaction. Then a few doctor, one or two doctor is recommended in severe form of bronchial asthma, they are recommended olfaction. Then here they suggested the medicine in different potencies like 30 to 100 BONO potencies. The one doctor has suggested that the method of administration can be done by olfaction. As a patient is in acute severe condition, it will be difficult to do oral administration sometimes. Then second reason is if the patient is very sensitive. And also it will be very effective to do high sensitivity. In bronchial asthma, if the patient is in highly sensitive state, so that even a slightest dose of the medicine will cause severe aggravation. In order to avoid this such aggravation, it will be very safe to use the medicine in olfaction method. In my practice, in severe form, I am trying this olfaction method. It shows better result. Then Herman in chronic disease then explained about the method of olfaction in the page number 219 to 220. Is an A dose of homeopathy medicine may also be moderated and softened by allowing the patient to smell a small pellet moistened with the selected remedy in a high potency and placed in a vial, the mouth of which is held to the nostrils of the patient who draws in a momentary little before it. Little before it means is not advised for the deep breath. Even you advise a deep breath, sometimes it will make some unwanted aggravation. That is a method is recommended by our master. Then, as a Kent explained, Kent opinion, it may be better to use the series of potencies beginning from low to higher potency as the susceptibility varies during the treatment. But in my understanding, our master, then Dr. Henneman, used almost cases in 30 potencies. The technique also I convey with you that because why I highlighting this one, the reason is the Hahnemanian, the latest research is this one like our 50 millismol scale of potency, but majority of the practitioners are just omit this technique. But in my personal request, just to try this method, this olfaction method, the freshly prepared pellets, just you smell it, is very useful for manage for, especially in acute asthmas, that is in a hypersensitive patient, just to try this olfaction method. They're very useful, no doubt. Next, this is a procedure how to prepare the pellets for the olfaction. And then the time is very short, therefore I am not playing this video. Then next, the sixth question, type of management in chronic asthmatic cases. Is and whether it is a symptomatic or a specific or a constitutional or any other your suggestion. The majority there of the opinion is a symptomatic treatment. Then if you then same rank also given, the little more rank you are given for the constitutional medicine, especially for the management of the chronic asthma. Then few doctors are recommended both the symptomatically. For the acute management, they are used certain specific medicines. Then most of the doctors then symptomatically plus for the chronic cases, they are recommended the constitutional medicine. This time I remember to then common a doubt arises in between the homeopathy doctors how to what is a constitutional medicine, what is the miasmatic medicine. The different opinion is there, but my strong thinking, the constitution means there are two levels. One is the mental and as well as the physical plane. The mental part, there we are considering the two. One is the temperament and second one is the personality. Then the physical part we are considered the tendencies, the dyscrasia, plus not a disgrace, in addition to the diathesis, plus the disease, aversion, and thermal modality. Then in these 4 or 5 sectors, we are collecting the symptom from the patient. We are the right way, we are able to make right constitutional medicine. I repeat, then just you collected the mental part, the temperament, and the personality. But in the physical part, they are considered the tendencies or plus that is the pathological general, the plus the tendencies plus disease, aversion, and thermal modality. That time we are able to select the right constitutional medicine. But then in this particular survey, there are only 2 doctors are recommended they express their use of the specific medicine for the bronchial asthma, especially in acute management. Actually, the constitution is the very vast subject. It will be difficult for us to discuss here in this short period, but that is the procedure or the parts of the constitutions are mental and physical. Then mental include the temperament and then personality. Then physical include, here already conveyed, there's a disease, aversion, thermal modality, and tendencies. And according to the Henneman in aphorism 18, the totality of symptom in each individual cases of disease must be sole indication, the sole guide for the selection of the remedy. In homeopathy, there is no specific remedy for the particular disease. The Henneman says the specific, that means the indicated homeopathic medicine, there is a minimum, is the specific for the individual case. Thus, we are going through the aphorism number 154, that definitely they are learned what is the specific in homeopathy. In order to find out such remedies, the strict particular treatment or individualization of each of the disease is necessary. That's also we are learned from aphorism number 82. The individualization is the cardinal principle of homeopathy. Then specific, then already convey with you. Then next, the seventh question is what potency do you prefer during the chronic phase of bronchial asthma? The low, medium, high, or LM potencies. The majority of says the medium potencies, medium. Then another next, the high, they use the LM potency. The potency selection is based on the susceptibility. Higher the susceptibility, then higher the potency. Here the potency selection is also very important for the immediate result. The right potency are selected, the result is fast, rapidity and gentleness, rapid and gentleness is there. Then which are determined by the factors like the susceptibility, determined by age, sex, then state of the disease, then environmental influence, etc. Then eighth question, can you mention some cases which you feel the different from other cases of bronchial asthma which you have treated with the characteristic indication of medicine, if any? Their answer, then a few suggestion is there. The peculiar characteristic symptoms: asthma amelioration by evacuation, pothos, then asthma with nose block. Then one doctor is recommended this medicine, ammonium carb. Then asthma with the peculiar position, aggravation, full moon, is in Medorine. Then subsidence of asthma and appearance of eczema. One doctor is recommended a very good medicine is sulforonam, because both are ectopic in origin. Then humid asthma, the doctor is recommended natrum sulf 200. It is a specified potency, natrum sulf 200. Then in asthma in children with a pleasant temperament, is a pulsatilla. Then hysterical ladies, their own doctor recommended the Moscas, is a wonderful result. The amelioration by cold air, they recommended Caladium. Then bronchial asthma with hypertension. The history of mortification is there. They recommended medicine, one doctor, Kolchika. Bronchial asthma with hypertension or history of mortification. Then bronchial asthma, the fear of insects, the sleep with the half opened eyes, is an thirst increase for the cold water, belladonna. One doctor recommended. Then another doctor, the child is mourning at the end of inspiration. Child is lying only in vertical position. Belladonna. I am trying this belladonna in 2 cases. It's a wonderful result. Then this time I am remember a case, a pneumonia case. And trying the 4 or 5 medicine, but it's not improved. Then finally one day, then auscultation. Then I work out this symptom. The end of the inspiration, the child is mourning. that symptom basis and prescribe the belladonna. The next day itself, then patient is recovered from the temperature and everything. Then next day, then after the within 4 or 5 days, the child absolutely normal. Therefore, belladonna is one of the best medicine for the management of different respiratory disease. The bronchial asthma, the tightness of chest, already convey with you, is an oblique to take a deep breath, chest oppression, asthma with intense anxiety, is an moscus. Then bronchial asthma alternating with the skin symptom. Then aggravation sleep into amelioration by sleep, then again amelioration by cold air, caladi. As an on case, the video. Then dyspnea with the 2 paroxysm of cough. In that case, then the presenting case, then asthma in children, and recommended the dyspnea with the 2 paroxysm of cough. They are recommended medicine, one of medicine, puja. Then ear pain, aggravation while coughing. Then one medicine is Antuja. Then one of the best remedy in children's asthma is Antuja. Is another characteristic symptom. Then sneezing aggravate after masturbation. In this case, then the sneezing, then followed by bronchial asthma, the starting bronchial asthma. But the symptom we are collecting from this case, the previous case, the sneezing aggravate after masturbation. The modality aggravation cold. That's a young weak person. Is the medicine is alumina. It's just to remember alumina. It's an importance of the characteristic symptoms. Then humid asthma, then asthma in children, then asthma in children with the pleasant temperament pulsatilla. Then next question, the 9th one, what is the frequency of repetition of medicine in acute phase? Then do you follow any parameter for that? If yes, the good you suggest, please mention your experience. Then almost all the doctors in this survey, the doctors like Dr. Krishnoma, Dr. Srijeev, Dr. Mansur Ali, Dr. Badran, Dr. Hanuman, Dr. Sambarati, and Chidambaranathan, Dr. Murugan, Dr. Edward, Dr. Mahesh. Then almost all the doctors, around 30 or 35 doctors, in their practice, they are frequent, they suggested frequent repetition. Then some advise that it can be done by giving a aqua in water dose, in water in divided dose, in order to avoid unwanted aggravation. Then a few doctors recommended flushing method. Then some have advised to give LM potencies in such cases. The repetition of medicine of the dosage also depend on the individuality of the case. Here we know it is even now rather was a controversial matter about the dose and the repetition, normally in between the homeopathy doctors. Many practitioners correspond it with their experience, but most of them agree with the wait and watch method, especially in chronic asthma, which is most suitable for our system. It is accordance with our cardinal principle, the live simplex and minimum dose. In my opinion, it should be minimum, so that once the medicine started acting beneficially, then we should stop repetition or increase the duration of repetition. Then another one more thing. Suppose the patient is the demand of the 3rd or the 4th dose of medicine, but a doubt is there. But the patient, the symptoms are remaining. In my personal practice, just rise the potencies. Just you should rise the potencies. Is very useful for you. Just help for you, because then already given a particular dose, maybe isn't sufficient for that particular case. But again, we are repeating the higher potencies is an antidoting the previous medicine. Therefore, there is no any issues Therefore, you should slightly raise the potency. Then suppose the patient is need the second or third dose of medicine, the next dose of medicine, again a doubt is arise. That time, just you raise the potency. As in a case of the antimonium tartaricum, is a wonderful result is there. They are considered two symptoms. Then is another case.
Dr. Ajayan, if you have to play video, you can play now. We can have finished another session. If you have enough time, you can play the video also.
Okay, sir. The coming days and we are just trying. Just because, sir, now we are finishing this 20%. Yes, sir. The only
I think we can finish the half of the questions, then and have a discussion. And so, because it is extensive, wonderful work, no need of going through hurry manner.
Okay, sir. Okay, sir. Then 10th question. In your long career of the treating of bronchial asthma cases, what is the scope of homeopathy medicine? If you have any statistics, please attach. Then almost all the doctors that says is a very good result. In homeopathy has very valuable scope in the management of bronchial asthma, especially our atopic and other allergic tendencies. In modern medicine, they are described that it's an acute management is done by means of immediate anti-spasmodic and anti-inflammatory along with the bronchodilators and oxygen administration. Then, but the chronic stage, they usually managed by lifelong bronchodilators and bronchodilators administration. And never can prevent the acute exacerbation if the patient is exposed to triggering the factors and never can cure. By homeopathy treatment, the first interval of the reoccurrence can be prolonged, then the prevented and can completely and permanently remove the disease, and the cure can be attained. And then almost all the doctors have said the scope is very high. Then one doctor says that compared to the other system of medicine, then homeopathy is in very good scope. Then another doctor, their opinion and their practice, the 90% of cases, only one doctor, this ratio, 90% of cases that approached me get either relieved or cured. Only one doctor. Then others, their percentage is in between 60 to 70. Then for one doctor from Mathura, he says an excellent, but he's recommended one medicine, arsenic album 200, then pepper salt, then natron salt. The next question, do you use any modern investigative procedure? An example, spirometer in assessing the severity or the prognosis of asthma. This part is, in my personal opinion, then frankly, they're right way, the majority of doctors are says they are not use these modern investigative procedures. Then majority says an answer is, they frankly says no, it's not good. Then because this area is very, that means that not only for the bronchial asthma, then all the diseases here use the different, the modern investigatory procedures, utilize the modern investigatory procedures. So because what is the use of the spirometry? Then mainly it will use for the research purpose. Then also it will help for to understand the prognosis. Then if the spirometer here used for this in our practice, definitely we are able to differentiate whether it is a obstructive lung disease or a restrictive lung disease. Then obstructive lung disease and restrictive lung disease and its management is entirely different. Therefore, in my personal, I am recommended, I am suggested, then coming days for the development of our science, the homeopathy science, definitely use the different investigatory procedures and evaluate our cases. We all know that the modern medicine is always having such a reluctance to accept our system as a scientific. This is mainly because of our lack of documentation of our cured cases. This documentation is mainly dependent upon the prognostic criteria. Then here for our prognostic, prognostic criteria is very important one. The investigatory procedure is spirometry. In bronchial asthma, we can very clearly diagnose it by the history and clinical signs and symptoms. But in order to assess the severity of the condition and efficacy of the treatment, we need the procedures like spirometry and pulmonary function test. Otherwise, then other science, the scientific world is not accepted. The majority of homeopathy says, then with the help of the signs and symptoms are sufficient to the selection of the homeopathy medicine. The spirometer or peak flow meter is a very simple instrument. Then and its evaluation also very simple. We can use it in clinic itself without any much training. Then ask the patient to take the deep inspiration and then blow into this and read the values. It's a very simple instrument. There's a peak flow meter. The values like then respiratory rate, then volume, residual air, etc. give us the capacity of lung during the attack and also after which gives the prognosis. So it is always advisable to all of us to use. Then spirometry, it is a help to specifically the measurement of the amount of air, that is a volume, and flow, that is a speed, then of the air can inhale or exhale. That is a simple technique used in spirometry. Therefore, my recommendation, most of the doctor has not used these modern investigatory procedures, but my recommendation that you must properly utilize the investigatory procedures in our day-to-day practice. Okay. It's a spirometry. Is a pulse oximeter. Then, for example, the pulse oximeter is nowadays a very relevant one. Is mainly helpful to the manage or evaluate the case of COVID cases. Then also very useful for the post-COVID cases. That is helpful for the oxygen saturation. Very recently, then 3 or 4 days back, one lady is in my clinic. That is a classical symptom of arsenic alpha. The first time she is reached on homeopathy treatment, but she is not aware about she is previously affected with COVID infection. But the patient is the weakness and respiratory effort, respiratory wheeze. The first time we have developed respiratory wheeze. And then for my academic interest, just I checked the pulse oximeter. The time the oxygen saturation is 89. The repeatedly, with the help of another instrument, we are repeatedly checking, then it's not exceeding 88, 89. The time I admit the case in my casualty, and the classical symptoms are there is of our arsenic album. This might let my surprise. Then a 2 dose of arsenic album is given. Then around evening time and 5 or 10 times we are recheck it. Then with the help of the same instrument, then the oxygen level is reached to 98.
Yes,
Right or no?
good. Okay.
Then
I think
within
with
2
that, yes, I think that discussion we can go to question and answer session. Then we can have another day of again. It's a very valuable and informative session. So can have another session. What about you? Because we only 10 or 15 minutes are remaining. You can't finish all these things today, is it?
Okay, sir. Shall I continue this one or just wait for the question?
Yes, we can have, because I'm sure about a lot of questions will be there, definitely, because everyone is very eager to know a lot of things regarding this. Already Dr. Ravish raised his hand already.
Okay, sir. That means in only 11 questions we are finishing the
Oh,
remaining.
no problem. We can have another session. We complete the halfway mark. Okay.
Okay, sir. Okay, sir. Therefore, therefore I wind up. Then 15 minutes remaining. Any questions you have, please ask.
Yes, sure.
Yes.
Yes,
Okay, sir.
those who would like to participate, please go to the participant list and raise your hand. Doctor, could you please close the screen sharing, Dr. Again?
I stop my screen sharing. Okay.
Dr. Ravish is waiting for a long time. Yes, Dr. Ravish, please. Please unmute yourself. Yes.
Sir, good evening, sir.
Good evening, Ravish. Good evening.
Sir, it was really an excellent class. I want to tell you 2 things. Can you please show the olfaction video? It will be very helpful. And
okay, definitely.
Second thing, I want to share my experience with Ajayan sir in this OPD. Regarding the 9th question, that is a repetition of dose. Because it was in the year 2008, a lady, almost 60 years lady, came with a MRI report to Ajayan sir OP, and the diagnosis was pneumonitis. It is a bacterial pneumonia case, and after case taking and all, the next day I had taken the case, and the next day Ajayan sir instructed to give a Pulsatla 31 dose. Okay, and the next the patient was admitted for 7 days, and actually he waited for 2 or 3 days, and the complaint starts declining after 5th day onwards, and on the 7th day the patient was discharged. And actually that is a patient son was an educator, and he is an employee, and he's of an irritable character, and Ajayan sir asked to come over 7 days for the follow-up. And on the second week, that is after 14 days, he demanded for a follow-up MRI. Okay. Then actually only 1 dose of Pulsatla was given, and on all other days, these placebos was running. And Ajayan sir confidently said, "You go for an MRI on the 14th day." You have to understand, the case was a pakka pneumonia case, and it was really a miracle for me. And he had taken on the next day from Trivandrum an MRI and bring with a normal lung pathology case, and that means a normal lung. So the 9th question, that is Ajayan sir said, is absolutely correct, that in asthma as well as in respiratory condition, the frequent repetition will definitely derange the condition. I really am so happy to hear once again from Ajayan sir about the repetition. Thank you, sir.
Yeah.
Thank you, Ravish. Because in my personal practice, not only in asthmatic condition, but especially then due to hypersensitivity, definitely the minimum dose is enough for you. Minimum dose is enough for you to cure the cases. No need of more and more doses. Okay. Thank you, Ravish. Thank you.
Thank you, sir.
Very nice question, and you should always share all these experience, because that will definitely encourage your teachers as well as the other participants of Ravish. If anybody is there to ask some questions or have to clear some doubts, please raise your hand. We have another session for completing this. We have only limited time. That is the reason. I have to go to the English session around by 9 o'clock. That's the reason we have finished here. If anybody is there, please raise the hand. Regarding the selection of medicine, I think that the risk factor is the similarity. If you select a remedy, then you should be more cautious. If you are giving a medicine, that much cautiousness is not needed. Then if you prescribe a drug, then again the response is still lower. So when you prescribe the right medicine, you should be more cautious. Then Hanuman uses a word that is the aggravation of his own disease. We must recognize that word. That sentence rather. Aggravation of his own disease. What is the meaning of this his own disease? Because this is the aggravation of his individual symptoms. So with that symptom, we can discriminate whether you have prescribed the medicine or a remedy. These observations are only applicable or possible in homeopathy. There are plenty of medicines. Without knowingly or unknowingly, you can administer medicine. That is also an advantage of it. I think there is an important factor here is that regarding the diet and regimen, we should be more cautious because we all know that the asthma is a medicine is a condition related to psychotic miasm. Then the hydrogen constitution are always aggravated by the raw vegetables or the juicy fruits. So that is an important thing. Dr. Elia Major raised the hand. Dr. Elia Major, please unmute yourself. Dr. Elia Major, please unmute yourself. Dr. Elia Major.
Yes. Sir, see, I want to know about this nebulization and olfaction. You said, oh, nebulization is not advised, olfaction is advised. What way the differs?
What is the? Tell me, ma'am. I not heard well. Sir, repeat the question, audible? Please. As now it's audible. Please repeat the question, please.
You said nebulization is not advisable. At the same time, you said olfaction is advisable.
It's not advisable, man. The nebulization and olfaction is entirely different. That's olfaction, but the majority of the homeopaths says the nebulization means the like olfaction, but olfaction is not a nebulization. That's I convey with you.
But I'm asking what way it differs.
What is the difference? The difference.
The difference, because in olfaction, just the method is like this. Just in a particular while, the freshly prepared pellets, just you touch the nostrils and to advise the patient for the just to inhale it. That is the olfaction method. But nebulization, just we are vaporize that one. It's directly that particles are reached in the lungs. But we are used the bladder or gesticula is contain alcohol. These alcohol, the particles are reach in the alveoli or reach the epithelium, it will damage it. That is the difference.
In olfaction also, danger is not advised, it seems.
Yes, at the same time.
Never.
Okay, it's a dynamic medicine.
Hanuman advised the medicated pellets the size of a mustard seed. Size of a mustard seed. That is important.
As then again is mentioned.
Yes.
One dose.
Yes.
The pellet size is again mentioned 1/200, the size of a pellet. 1/200. 1 grain is equal to 1/200.
No. 1 grain measures around 200 pellets. Size of a poppy seed. 2 or 3 of them put in 2 to 3 grains of sugar of milk, crushed between index and thumb finger, then administer dry upon tongue. That's standard dose given by Hanuman.
Yes, sir. Correct, sir. Correct, sir. Yes. Then again, a slight pressure is exerted. With the help of the nails, a slight pressure is exerted. This and specifically the mention in orthodontic.
Yes, sir. It's very specific. Everything is very specific. There is no difference. But what is the first important point is the similar medicine. See, the remedy is the first point. Then the potency, dose, attenuation. If you give medicines by dissolving in water, that will cause an aggravation, definitely. If anybody has some
Is-
doubt, you can prove yourself. That
is
is not-
recommended,
Yes,
is recommended for the standardization of homeopathy.
yes, yes,
This dosage is recommended for the standardization in point.
yes. Then regarding the fruits, see, very difficult, very dangerous thing to take fruits and you prescribe arsenic gel. So depending upon the disease, the patient, the environmental conditions, the weather, all these things should be considered. The individualization is also is applicable in all these things. The diet and regimen is also should be designed or modified according to the individual. As the Hippocrates says, according to people and situation is applied by homeopathy, not by allopathy. Isn't Dr. Ajayan?
Yes, sir. Yes, sir.
Sir, one more doubt. I used to give this old fashioned for the fits for when getting fever and all. Children will be brought by for fits and all. Then also I used to give the tincture, old fashioned. That is controlling the fits immediately. Is it wrong or
Maybe.
not?
Yes, maybe, madam. Is that very, maybe it will help for to correct the condition. Maybe. Okay. Is and more research is needed in this field. Because in my opinion, then suppose a minimum dose is acting, if it is a tincture or a potentate medicine, actually the dynamic power is enacting. Then just going to the lesonitis of Haniman, the belladonna root, the tincture is a minimum dose is used for the management of fever.
Okay.
Okay, sir.
Yes. I think it is time to
Sir,
wind up
thank
the
you.
session. I think Dr. Ajayan or Dr. Tanesh raised the hand. Yes, Dr. Tanesh. Yes, please. It's about to finish, Dr. Tanesh. Yes, please. Please unmute Dr. Tanesh. Oh, okay, right.
Good evening, also. Very good presentation, an excellent presentation and a different style, because Dr. Ajayan has done a wonderful job in something like a research work among doctors. That is something different from what is happening in and around the world. But he has gone through the experience of doctors and collected the data and made records, and thereafter find out which is the best thing for that and this, and that is something extraordinary. That's of course what is the relevance of these things, and how things can be not simply giving some kind of this tips. He instead come out with such a beautiful records. This is something that we have to do. This is something to motivate the doctors who are doing this kind of work with asthma. Asthma, as we all know, that every homeopath get asthma every now and then, but nowadays things are different. But sir's presentation is excellent. I must say that this is this kind of presentation is one of the things that we are expecting from professors like Dr. Ajayan and his junior like Dr. Ravish, and everybody. They are all following this method and the relevance of potency selection and everything. And he has just shown that he has just given 2 doses of arsenic amalgam to cure a patient. That even that itself is a motive. Thank you, sir. I hope you will come with the second part of the session in a few days or so.
Okay, sir. Thank you.
Hubert, please. In 30 seconds, we have to finish.
Yes, thank you very much, sir. It's a wonderful section. But I want to ask you whether we can generalize. Each and every medicine has its own potency and variations. There is some differences. One is acting in the higher potency, one is acting in the lower potency. Just I mentioned the Silesia and Hepar sulfactions. So if can be generalize the doses.
Okay, yes. Ajayan, please.
Sir, normally, then for this particular question is my personal practice, and my generalization of the case that depend upon the symptom of the patient. Then symptom means then different levels. There may be the intensified symptom, then intensity of a general symptom, a common symptom, and the intensity of an individual symptom is entirely different.
Okay.
Then, for example, the time is over. Therefore, I says, then for example, if the characteristic symptoms are their intensity is very high, we are use the higher potency medicine. Then normally, but the disease symptoms are the severity is very high, we are not able to use the higher potency medicine. That time we are use the lower potency medicines. Therefore, not only consider the disease, not only consider the individual disease.
Okay.
Then both are we are consider and select the potency. That's my opinion. Sir.
Yes, it is always conditional as homeopathy. Now I am inviting Farid Khan sir to say the vote of thanks. Sir, please. Farid Khan sir, are you there? Yes, sir, please.
Hello, am I audible?
Yes, sir, yes.
I have been listening to the excellent presentation. Anyhow, that time is up, so that I don't want to prolong my words. Let me express a plenitude of gratitude to the doctor for made an excellent presentation from on behalf of everyone of ATTENDEES. Doctor, thank you very much. All the best. We are expecting more from you. Thank you.
Okay, thank you, sir. Thank you, sir.
Well, that's the end of the 474th day. We shall be back again tomorrow with another topic. Till then, goodbye. And it's over to Dr. Tanesh for the Malayalam session.
Namaskar.